Good Day Austin on Fox 7.
We've got Austin OBGYN and Associates on the Zoom line here. Dr. Christy Malore and Dr. Laura Downing. How are y'all?
Doing well.
Well, thanks for joining us via Zoom. So y'all have something pretty unique. You've got a drive-through OBGYN clinic. How does that work?
Well, we're really excited to be able to offer prenatal appointments and other types of visits at the curbside for our patients, so that they don't have to come into the office and potentially increase their risk of an exposure. So for our patients, we're letting them know ahead of time that they're eligible for a curbside visit. We're even letting them bring their own urine specimens collected at home if they'd like. And when they pull up, we have some spots marked off, and we have our medical assistants greet them and do their vital signs in the car. We are able to listen to the baby with the Doppler at the car, and we measure their tummy and do all the things that we would regularly do at an indoor visit.
Yeah, it's pretty cool that you can do that. And I guess everybody's wearing masks and social distancing and all that stuff in the drive-thru.
Exactly. We're all suited up, and so we think it's a really safer solution for our patients than having to come into the office. And so far, it's been a big hit. Our patients really like it.
Yeah. So if a patient wants to do it, I guess they just give you a call and say, hey, let's do the drive-through option.
Exactly. We are happy to take the call and get them scheduled for that. And we're making an effort to notify our patients as well, so that it's as seamless as possible.
Yeah. And Dr. Downing, you're actually pregnant right now. Is that correct?
I am, yes.
Yeah. Well, my wife and I just had a baby. Talk to expecting mothers about what they can expect at the hospital. My wife and I went to the hospital in the midst of this coronavirus thing. It was kind of scary. Lots of stipulations and rules, and thankfully I was able to go in with her, but of course nobody else was able to come in. Kind of talk to the moms about what they're going to expect when they go to the hospital.
Sure. Well, congratulations.
Thank you. Appreciate it.
At St. David's here by UT, we are allowing one visitor to come in, one support person, and also a certified doula is able to attend as part of the healthcare team. Unfortunately, partners can't switch out, so whoever comes in with you is there with you for the duration. And that's really for everybody's protection. Babies are not being separated from moms. We have not had any infected OB patients of ours or infants. And so labor and delivery is also its own secluded floor with the NICU, the nursery, and labor and delivery and postpartum. So our nurses are dedicated to their own units, and we're not seeing overflow from other units in the hospital. So we feel thankfully very safe and sheltered.
Right. Just as an expecting mother, do you have some advice for moms that might be a little nervous going into the situation at the hospital? Yeah,
we're just, like I said, reassuring patients that the hospital is doing everything it can to be the safest for you. We have a separate after-hours entrance for our pregnant patients rather than having to go through the emergency room. And just reassuring moms that thankfully Austin's curve is looking good, and you're not going to have to deliver by yourself, and your risk of getting exposed at the hospital at this point in time is very low.
Great. Well, thank y'all so much.
I'll be having my baby there.
Yeah, definitely. Well, thank y'all so much for joining us on Zoom. Anything else we need to know about where to find you or anything like that? Or?
You can check us out on our website at austinobgynassociates.com. You can also follow us on Insta at ATXOBGYN. We are accepting new patients right now, and we're offering telehealth visits over the phone for new patients to establish care, or we can see most things curbside.
And you can find me on Instagram at Laura Downing MD also.
Awesome. Well, thank y'all so much. And it's a cool thing, the drive-thru. I appreciate it. Thanks for joining us this morning.
Thanks for having us.
Thank you.